Hi guys, Sydney here in the AFE Training Center. Today we have a patient that we're going to do a couple different treatments on to really try to tackle her necklace lines and her crepey skin in her neck. So we're going to start by using polydiaxonone smooth threads. I'm using the 29 by 40 threads. I have topically numbed the patient with lidocaine tetracaine ointment. She's nice and numb, and I've cleaned her thoroughly. I'm now placing these threads kind of directly into those deficits. Really slight angle to get in, just kind of break through the skin, and then I'm leveling off to make sure that I am in the right plane. You can see that they go in fairly easily. These threads are, like I said, polydiaxonone suture material, and they're threaded onto different size needles. There's a white plugget that kind of holds that thread onto the needle. When I'm ready to take that needle out, I give the needle a 360-degree turn, and it releases that thread into the tissue. That tissue then kind of breaks down that thread over time, and collagen is created, stimulated, and really helps long term with some of these skin texture issues, deficiencies, volume issues, all sorts of things. So you'll see I'm finishing up here, and then I'll move on to the other side. I'm using the 29 by 40 millimeter threads, so it is 29 diameter and 40 millimeter length. That 40 millimeter length is doubled over, so it ends up being 20 millimeters when it's laying in the tissue. There are all different sizes. There's 29 by 30s, there's thinner ones, thicker ones, there's twisted threads. The twisted threads are kind of doubled around and twisted around the needle, and those would just create more collagen just because there's kind of more thread there. You can see I'm kind of holding that skin taut, and now I'm going to give it a turn, and it comes out just fine. You can see this patient looks a little bit irritated. A lot of it's from the topical and just kind of placing these threads. She shouldn't bruise or swell too badly. Sometimes we just see little tiny bruises at the site where we inserted these threads. Arnica gel and arnica tablets typically help with that bruising. I'm now going in, after I've laid those threads kind of everywhere I want them, I'm going in with a Belotero light hyaluronic acid filler, and I'm filling in those deficiencies. So threads are going to kind of give us that long-term effect and kind of help in the long run building that collagen from the inside out. The filler is going to be an immediate effect to really fill in those deficiencies. You can see I like the plane I'm in, like the depth, I'm tenting up. I'm using a little bit of a longer needle to kind of really get more coverage. There is lidocaine in this product, so it'll help with some discomfort. The patient is doing phenomenally well. She's not feeling much at all because we did topically numb her. And I'm just laying really nice thin threads of product. I'm placing this product fairly superficially to really kind of fill in those lines. Now I'm moving on to that lower line, and I'm going to do the same thing. Sometimes it's hard to see when the patient's neck is extended like this. It's hard to see where those deficiencies are, so you just have to kind of maneuver your patient, have them tilt their head and bend their neck so that you can see really where those deficiencies are. In some cases, you'll see that kind of bleb of product. No worries, we're gonna kind of massage it in and make sure that we like the look of it. This product is very, very moldable. It's a very light filler, and so we can mold it easily. It's very fluid-like. I've now switched to an even longer needle just to kind of get a little bit more coverage with each poke. Um, that'll just help, minimize number of pokes because I'm getting more length out of each thread of product. Tenting up and giving a nice steady thread of that product. Perfect. And then I make my way to the other side, always being sure that I'm at a good angle. You can always move around your patient as you see fit and have your patient kind of move their head and move their neck to make it better for you to be injecting. Moving on to the other side, I'm going to kind of fill the rest of these lines. She has some bruising already starting over here. No big deal. It will go away. Make sure your patient knows, minimal downtime, but we kind of want them to take it easy. Make sure they don't have any big events coming up because they will have this bruising and swelling. They can take something for pain if they need to, but really I want to know about it if they're having that type of pain. Definitely no blood thinners of any kind. Um, we can always ice the area. That tends to help a lot. You can ice before, you can ice during the procedure, and then they can definitely ice after. But typically people do very well with this. With the threads in there, sometimes people will get what we call zingers, and that's kind of just when the end of that suture material kind of tickles the tissue until it starts integrating, and you'll feel just kind of a little zinger. I've noticed it sometimes when people are driving in the car and they're looking to merge. When they turn their head in that way, they might feel a zinger. It's not harmful in any way. We like to say it's just kind of a reminder that those threads are in there. Moving on down to that lower line on this left side, I'm going to fill the remaining deficiencies and then we will move along. I've used a total of, I'm working through my second syringe right now. So total of 2 syringes of this product will probably be used at the end. I'm figuring out where I kind of want to place the remainder of this product. I have a little bit left, and of course I don't want it to go to waste, so I'm going to place it down in this lower thread that has some deficiency and just try to smooth that out, blend these lines in. We won't get to full correction in one treatment, but it'll really, really help. These lines tremendously bother this patient. She feels like it's kind of what everyone's looking at when they're talking to her. Um, and it's all relative. To me, that's definitely not the first thing I notice, but it bothers her. So our goal today is to really smooth these out and make them less noticeable. I change my needle tip every so often just for ease and comfort. I'm now putting some arnica gel on and I'm giving a really light pressure, kind of molding that product, making sure there's no lumps or bumps, and the arnica will help with that swelling and bruising. And I'm just kind of feeling to feel if I feel any product kind of balled up or anything like that. Sometimes it just doesn't come out in such a linear, smooth fashion, and that's the nice thing about this product is we can really mold it with just some gentle pressure. The patient actually likes this massage. She says it feels good. At this point, she should be pretty numb and not too tender because she had that topical lidocaine tetracaine ointment on, and then she got the lidocaine from the filler. So she should be pretty numb in this area. You can see here I'm kind of just working through one of those little balls of filler, and it should just smooth out just fine. You can see that kind of bleb of product that I got on that lower line when I injected has already kind of dispersed, and you can see that it's gone. And these marks, of course, are just from going in. The bruising and the irritation, those will subside rather quickly. I'm doing thorough education with my patient, no makeup day of, really keep those sites clean because we went in so many times. Here is the third and final part of this treatment. So we did the threads for kind of long-term benefit to really create collagen in that area. We did the filler for that instant fill, kind of reduce that volume deficiency appearance. And now we're doing microtox. So microtox is all the rage these days. It's hyperdiluted neurotoxin. You can use, whatever type of toxin that you prefer. And I'm placing this product extremely superficially to really help with skin texture, pore size, and it'll kind of help blend these lines in. You want to see that bleb. I'm going just under the skin. You can see at sometimes this product kind of oozes out, no big deal. Of course, we want to limit the amount that we waste, but sometimes it just happens. I do urge you to wear some sort of eye protection because sometimes this product will kind of squirt out if you're not in the tissue or in the skin enough. And you can see I'm just pushing a tiny bit of product with each injection. I'm going to kind of wipe that blood and product away. I have broken up the neck into 4 quadrants just for ease of splitting up the product that needs to be injected. And I'm making these kind of just linear lines, little blebs of product. This shouldn't be very painful at all for the patient. Just a tiny bit pinchy. And that's exactly how you want it to look. You kind of want to be able to see these little blebs of product. And I will make my way across and then to the other areas. Moving on down. And these Comfort Tech syringes that I'm using are multi-bevel, so they're beveled all the way around. They're 31 gauge, 8 millimeter length, and I don't need to make sure that bevel is up because it's beveled entirely. Which makes this whole process a little bit easier. And I'm just pushing a tiny bit of product in each. You won't get that kind of bleb of product with each injection, but you should with most of them. That makes you can be certain that you're kind of placing that product where it needs to be. As far as learning how to do this, we highly recommend being certified through the AFE. We teach all different level courses, and you can definitely learn how to do all of these different procedures. These procedures don't need to be done all together. We just happen to have this case that we thought using all three treatment options in one would really be a great idea. Smooth Threads is its own course, and then we also teach level 1, level 2, level 3 Botox and fillers. We also teach some master courses, so master eyes, master lips, master nose. We are now teaching ultrasound. We have cadaver courses, so highly recommend getting certified so that you too can perform these procedures. It's really nice kind of as you work your way from the beginner courses into the master courses, you can build on your skills and your knowledge and be able to kind of come up with a treatment plan like this and use, many different modalities to treat these issues of concern for patients. Had we only done Botox, we wouldn't be able to properly and entirely treat this patient's area of concern. Making my way through that last quadrant, be sure to stay tuned after this video for a before and after. The before and after will just be after this one treatment. So I will see this patient back and we will continue treatment to continue tackling um, these necklace lines, tech neck, whatever you want to call it. Tech neck is what it's referred to nowadays because we're constantly looking down at our phone, right, and kind of creating those deep wrinkles in the skin. So the before and after will definitely reflect kind of the progress that we've made, and we'll continue working at this for treatments to come to really get to a point that the patient is happy. Thanks for watching, guys. Stop by next time for more interesting treatments.